I'm Dr. Dan Henry, talking tonight about migraine at school. I'm joined by panel participants, Melissa Piercey and Elizabeth Weyher from the Danielle Foundation. And we're here talking about migraine at school. First of all, I'd like to say that migraine at school is so important because migraine is a severe neurogenetic brain disorder. And when we talk about children with migraine, we're talking about 10% of school-age children under the age of 10. And when we get to older students and children, we're talking about 28% of adolescents, over 10% of boys, and over 18% for girls. Students with migraine miss oftentimes more than 2 times more likely to miss school, and children with severe chronic migraine are lucky to be in school at all, and so oftentimes need major accommodations to be successful, to be happy, to be able to feel like they can be successful. Migraines often present very differently in children. Very young children, children under the age of 3 may commonly present with irritability, episodes of severe abdominal pain. They may have motion sickness, which is 4 times more prevalent in migraine patients than in non-migraine patients. Oftentimes children in early ages, preschool and school age, will present with abdominal migraines. And this means that they may go years before they ever complain of headache or visual disturbance. They may present with episodes of severe abdominal pain, nausea, vomiting. They may have headache or they may not. They may be confusional at times. They may have some brain fog, but it presents oftentimes very different and hard to diagnose. My journey with migraine disease started with my youngest daughter when she was under 8 years of age, back in the mid 1980s. She would have episodes of periodically of abdominal pain, vomiting, complain of light, noise sensitivity, and episodic episodes of severe headache. This started me on my journey for trying to find answers. And despite this, back in the 80s and early 90s, there weren't a lot of answers. We saw a lot of experts here in Utah and around the country. But despite that, her disease got worse and worse. She oftentimes looked like she was having strokes. She would have weakness, one arm, one leg, where she couldn't move, or she'd get very dizzy and fall. And her episodes became more and more severe until they were chronic. She was an amazing child. She was very bright, very athletic, had incredible skills, and this disease just kept eating away at her until her death at the age of 17 in 1999. Now I'd like to turn this program over and go further into explaining why this is so important to identify children and to get them the accommodations that they need in school to be successful. And Melissa?
Melissa, I think you're muted.
So sorry. Okay, starting over. So migraine at school. is an incredible program that was developed by the Stigma and Education Committee of CHAMP, which is the Coalition for Headache and Migraine Patients. In partnership with coalition participants, the committee has gathered the best resources and information for students, parents, and educators to ensure that all kids with headache diseases are given the best opportunity to excel in school. So it's a comprehensive package of materials which work for their specific audience, but they're most effective when used together. So the materials include, first we have the student infographic. So when a student has exhibited symptoms of migraine, they'll be given this to bring home to discuss with their parent or guardian. It offers tips for self-care, has suggestions to help give the student a voice, encouraging them to advocate for themselves, which is super powerful. Next, we have the parent infographic. So this one has the most information because the parent needs to know and do the most for their student. It tells them how to help themselves. It encourages them to educate themselves about migraine to help them better advocate for their child. It reminds them to take migraine seriously and teaches that not all migraine symptoms are headache and that many other symptoms, as Dr. Henry said, can include nausea, vision changes, ear discomfort, all sorts of things. Additionally, it recommends scheduling an appointment to see their doctor. There are steps parents can take to get their child the help that they need. First is proper diagnosis. Encourage them to see a headache specialist or a doctor who understands migraine. So you can go to your own doctor and ask if they know about migraine. And if they don't, we actually have information to help your doctor as well. And your doctor can also give the student a letter. We have a form for that they can bring to school to facilitate a possible 504 or an IEP. And it suggests how to help their child manage lifestyle choices and consideration for meeting with a pain psychologist or other mental health professional to identify coping strategies because recurring pain does cause anxiety. Then finally on this is a list of possible accommodations that you can bring to the school, discuss with the school, and be better prepared to see what your child might need. So many of these accommodations are one size fits all, but they can be tweaked for to better fit an individual. Then we have the educator infographic. So this would be given to teachers, the school nurse, counselor, front office ladies, whomever will be seeing the students when they're not feeling well. Often there's a pattern that develops with these students, and this will help those people recognize them. And it also offers guidance for caring for a student during a migraine attack. We also have a really awesome poster. So the poster looks like the same infographics on two of our other infographics. It has the cute little infographics of the little faces and the illnesses that they could be having, various symptoms. And that poster can be put up in a sick room, break room, front office, throughout the school, wherever, to help students recognize these things as well. So it is known that episodic migraine, that's those that occur occasionally, can become chronic, which are 15 or more per month. And in many of those cases, it's possible to prevent this through early intervention. So we do have a screener, which is really cool. So it's for pediatric and adolescents. We have one that's for the lower grades and one that's for the higher grades. They're just worded a little bit differently to be age appropriate, but they're basically the same. It's just 4 quick questions on how do you rate your headache pain? Does your head feel like it's throbbing or pounding? Does your headache get worse when you walk, etc.? And finally, do you frequently have nausea, vomiting, and or stomach pain? So if kids have had the screener and they screen yes, then there is a document that will go home to help the parents gauge their children's symptoms and suggest sharing it with their doctor to assist in getting a proper diagnosis. And finally, we have a lesson plan. And the lesson plan is really awesome because it can be used in junior high and high school in health classes, and it has everything that a teacher will need and is fully downloadable. So if you have migraine and you are interested in bringing that to your school and to show to your teacher, that's really a cool thing to do as well. And the lesson plan is such a valuable tool because it educates, it raises awareness, and it can decrease stigma all at the same time. So all of this that I've just mentioned can be found on our website among a whole bunch of other things. And so everything is self-contained, which is really cool. So if you could go to our website, migrainatschool.org, and check everything out. And finally, why does this matter? Dr. Amy Gelfand, MD, is a pediatric neurologist and headache specialist, and she has said, the brain learns from its own behavior. By treating early, we can change the trajectory of the disease. So in order to treat it early, migraine first must be diagnosed. Most people do not know the signs and symptoms, nor do they seek professional care or a diagnosis. Early intervention at school will provide better trajectory for these students who have the support of their educators, which will maximize their learning and overall success of their education, which is why Migraine at School is so important.